My name is Faith, and I'm a registered nurse and board-certified lactation consultant, and I've been in practice for about 15 years. This is Jane, and she's going to help me show you how to feed your baby or feed a baby not using a baby bottle when they're newborn. So in this video, I'm going to show you 4 different ways to feed a baby that doesn't include using a bottle. The first way is going to be syringe feeding. The second way is spoon feeding. The third way is cup feeding. And lastly, we're going to use a supplemental nursing system to do finger feeding. Many parents struggle because they know that the first month of breastfeeding is crucial, and that in the beginning, babies are very delicate. They're very easily disturbed when it comes to their breastfeeding instincts. And by introducing a bottle nipple, an artificial nipple, too soon, it can really disrupt breastfeeding, and research shows that it can make the baby quit breastfeeding sooner than we want them to. They can actually come to become very fussy at the breast, and they can even reject the mother's breast after they've received the bottle in the first week or two. Experts, including the American Academy of Pediatrics, recommends delaying introducing a baby bottle to a baby, ideally until about 1 month of age. Sometimes there's reasons why we have to feed babies other than at the breast in the first month. For instance, maybe they have a medical need why they need an extra or supplemental feeding. Maybe they have jaundice. Maybe they're losing weight too quickly. Maybe they're having trouble latching onto the breast. Or maybe they're just going too long between breastfeedings and we want to maintain their blood sugar. So for these reasons and other reasons, like maybe just the dad or the grandma wants to feed the baby, there's other ways that we can make sure that the baby gets a feeding without disrupting breastfeeding. So firstly, what you need to know is how to actually collect the mother's milk. My first rule of thumb is always feed the baby the mother's milk first, rather than using artificial milks, because if we can protect the baby from getting artificial milk, the baby's just going to be healthier and have less allergy risk for allergies. So to collect the mother's milk, there's a couple of ways that you can capture it. In the first 3 to 5 days, mother's milk resembles honey. It is thick, and it is a very small amount comes out. In fact, on day 1, a teaspoon is a full meal for a baby. So just 1 teaspoon of milk is a full meal for a baby, and it comes out very thick and rich like honey. But how do we capture it? Some women use an electric breast pump, and I'll just show you a way to collect milk using an electric breast pump. So what the mother can do is when she's pumping, she can slightly tip back the breast shield like this. And that way the milk will pool or collect right here. She can then detach the assembly and put a small cup right underneath, and then pour the small amount of the drops into that little cup. Another way that's very easy for a mother to collect drops of milk in the first few days that can even be more productive than a breast pump is learning to do hand massage or hand milk expression. Stanford University has a very good video on how to do this. If you search the word Stanford and hand milk expression, you can see Dr. Jane Morton's excellent presentation on how to massage out milk in the first few days and hours of the baby's life. So it can be collected in a little medicine cup like this, and then simply sucked up into a 1 milliliter oral syringe. And you'll notice it has a little blunt tip, so it will never hurt the baby. And the mom can just simply suck up the milk she's collected, that small amount, into the syringe like so. In my facility, we have little caps for our syringes, which makes it very easy to store the milk and to easily put it in a cup of ice, which can be gently reheated under hot water, or by just the parents just holding it in their hand for a while can reheat it to room temperature. And then when it comes to feeding babies, with the syringe, it's very simple, but there's a few little precautions that you want to take. The first thing I want you to know is that using these alternate methods of feeding babies doesn't take longer than bottle feeding. It just takes more, you just have to be more careful so that the baby doesn't accidentally choke or have issues. But studies show that these alternative methods of feeding are exceedingly safe. In fact, syringe feeding, 1 droplet at a time. So about 1/10 of this 1 ml syringe was shown to be safe in a study with babies who are premature, even down to 32 weeks gestation. So when you're getting ready to feed a baby in this way, normally for breastfeeding, I always want the baby's arms unswaddled. That's because the baby's hands actually help them find the breast and do the right behavior for breastfeeding. But when it comes to using these alternative methods, I do like the arms swaddled. And the reason is that it just makes it easier so that the baby doesn't accidentally spill the milk on you. So we'll just swaddle her arms. And another thing is that you always want the baby's head tipped back. So you never want the baby's head crunched forward because that would close their airway. You always want the baby's head tipped back so that their throat is open and their airway is open, and it's much easier for them to open their mouth and to swallow. So what we'll do is we'll just introduce the syringe. And for a sleeping baby, what you can do is just simply touch the chin and open the mouth like this. Or you can just drag the syringe on the upper lip until the baby opens her mouth. And then you simply just pop in a little drop at a time. I find it helpful to rub right under the chin because it helps the baby stimulate a swallow in between. When the baby's ready, you can just open her mouth and introduce a little bit more toward the cheek and then pull the syringe out. You don't want the baby sucking on the syringe because that would defeat the purpose of this exercise. So the purpose is just to introduce a little bit of milk. And amazingly, if a baby's gone a long time between feeds and you're worried about the baby's blood sugar, just 2 of these syringes will elevate the baby's blood sugar tremendously and stimulate appetite and make them want to breastfeed again. So it's this is a very effective method of feeding for the first 24 to 48 hours. And it's also really useful when the baby's sleepy or has gone a long time between feedings, because you can just introduce a tiny, safe amount at a time into the baby's mouth that will elevate their blood sugar and help them maintain. All right, so we will move on to spoon feeding. So once we have, it's been maybe a couple of days since the baby's been born, mom's going to be producing a bit more milk, and the baby will have better airway control too. And so when we have a bit more milk to work with, I would say more than 5 syringes. I use syringe feeding for up to 5 milliliters at a time. If you have more than 5 milliliters, it's time to move to a different method because it's going to get too tedious. So if you have less than 5 milliliters, go ahead and syringe feed. If you have more than 5 milliliters, let's move on to spoon feeding. So you just simply take your little vessel with your milk in it, and you can just use any plastic spoon. Remember, for breastfeeding, you don't need to sterilize. You just need something nice and clean. Soap and water works well, but plastic spoons work very well and are usually available in the hospital too. So we'll just take, I would say, a little tiny bit in the bottom of the spoon, maybe just 1/3 of a spoonful at a time. And it's really, really easy just to tip it into the baby's mouth, and you can catch the drips very easily with that spoon. I like putting a little bib or something underneath to catch the drips too. And the baby, you'll see, tolerates the spoon feeding very well. A beautiful thing about spoon feeding is what it does for the tongue muscles. When a baby is bottle feeding, a baby is learning to bite with its gums, and it's learning to hump its tongue backwards. And these are not good for maintaining breastfeeding. They're not good moves for getting milk out at the breast. But spoon feeding encourages babies to stick their tongue forward, and it's very therapeutic for babies who are refusing the breast. So what I found is that when babies have been bottle feeding for a while and I'm trying to get them back to breastfeeding, just a few sessions of spoon feeding can make them really want to breastfeed because they're using their tongue muscles differently. There are more than 16 muscles in the tongue that operate separately to help babies suck and swallow. All right, so that's spoon feeding. And again, we'll use that if we have about a tablespoon of milk at a time. Now, if we get more milk than that, maybe we have now up to 1 ounce or 30 milliliters. When the mom's producing more milk, usually by day 4 or 5, typically what we can use is an at-breast supplementer, but we can use it with our finger if we're not the mother. So ideally, the mom can use this little tube like a straw at her breast to feed the baby. And there's many good videos online about how exactly to do this at breast supplementer or SNS. But I'm going to show you finger feeding right now. So the first thing you do is you have your little tube assembly and you have your little valve assembly. This is a Medela product called a starter SNS. It retails for under $20 and it's a little bit hard to find. You have to go to a specialty breastfeeding store usually for this, and you can find them online as well. A lot of hospitals stock them. So here is the valve assembly. Now what's important is that when you insert this, the 4 dots have to face up. I kind of view it like a little happy face. And if you invert it, there'll be milk everywhere, so you don't want to do that. So what you do next is you screw this onto the bottle of milk. Nice and tight, but not too tight. And then what you want to do is you want to squeeze the nipple to prime the tubing. And first what we'll do is we'll close the little valve so we don't get milk everywhere. There's a little tiny valve that we can just pinch off. And then what we will do is we will squeeze the nipple, turn the bottle upside down, and you're going to see this area fill up with milk when we give it a few squeezes. And that way the tube will be primed as well. It comes with this little lobster claw that we can put around the bottle, which helps use gravity to disperse what's in the bottle. And so this little lobster claw can nicely clip onto my clothing and help me keep the bottle out of the way and up above the baby's head. Oh. So now what I can do is use, because I'm not the parent, I will always wear gloves if I'm feeding a baby with the SNS. Because I don't want the baby getting the dirt from under my fingernails ingested. But as long as the parents have nice clean hands, they don't need to wear gloves. And I will just tickle the baby's mouth until she opens wide, just circling her mouth. And then I'll wait until she opens and I will introduce my finger and the tube. At this point, I'm going to make sure that I open the valve so that the milk can flow out to the baby. And you can see right now that she's sucking milk by sucking on my finger. My nail side is down because I don't want to cut the roof of her mouth. And then she will just go at her own pace and she will suck and she will pull the milk in. Why is finger feeding advantageous over bottle feeding? Well, the reason is because my finger is a solid object and it's not rubbery, so it doesn't encourage the baby to bite, and because a bottle will bounce when the baby bites and it feels really good to bite it. But with my finger, my baby will do more correct tongue movements that simulate breastfeeding a little bit more. Also, the baby has to open a little wider and my finger can go farther back into the baby's mouth, which is more similar to breastfeeding. So my goal would be to get my finger as far back into this baby's mouth as I can without gagging the baby. So it's typically as kind of close to where the hard and soft palate meet. And again, my nail side is down and I want the tip of the little straw to be right at the tip where my fingernail starts. And so the baby will self-pace this feeding, and it's a really nice way to keep the baby on track with breastfeeding, because this is much more work for the baby than just bottle feeding where the milk pours out freely. It really does encourage the baby to work and pace themselves more similar to breastfeeding. So it's more ideal. Another nice thing about finger feeding is that if the baby's under billy lights, the baby can still get feedings where the parent can introduce the finger with the milk while the baby's under billy lights. And if at any time the baby's struggling, the parent can turn the baby to the side and pull out the tube. So I hope this has been helpful for you. If you would like to email me any questions, my email address is faithmcginn@gmail.com. That's faithmcginn@gmail.com. And just to review, to help us decide how to feed the baby, we need to ask ourselves these questions. Firstly, how old is this baby? So if we have a preterm baby, we're obviously going to be very careful with the baby's airway, and we're going to go a lot slower, and we're going to maybe use something like syringe feeding a little longer, or we're just going to kind of assess where the baby's at to help us decide what method we're going to use. So typically the first day or second day syringe feeding works well, and then from there on you can kind of progress based on mother's milk supply. Also, what kind of milk is it that we're using? Colostrum is very sticky and thick and viscous like honey, so it has a low risk of choking, and so it really is suitable for syringe feeding. But if the mother's making a lot more milk, we may want to move on to one of the other methods like finger feeding more quickly. And thirdly, how long do we expect the baby to need supplementation? If we have a really early preterm baby, in my professional opinion, if we're going to be supplementing more than 3 days, and we know this from the start, I'm just going to use a bottle right away. And I'm going to use a bottle to work with the baby and make sure the baby's getting enough feed volume. And then I'm going to use these alternative methods that I've just shown you to reacquaint the baby with the breast later. So I'm going to use that to kind of be a breadcrumb trail to lead the baby back to the breast. So maybe for, you know, a couple of weeks, the baby's been only bottle and breastfeeding, and then the baby's not, you know, kind of very fussy at the breast or difficult to breastfeed, and the baby's solely bottle feeding, but the mother's pumping and making lots of milk. Well, then I can use spoon feeding for maybe 2 or 3 feedings in a row to get the baby's tongue muscles working in harmony and get them organized so that the baby's going to be more likely to be a successful breastfeeder. So here's a few measurements that may help you out as well. Just remember that 1 teaspoon is 5 milliliters, 1 tablespoon is 15 milliliters, and 1 ounce is 30 milliliters. So I'm going to, one of the ways I'm going to determine which method to use is going to be how much milk am I working with. So typically, if it's under 5 milliliters, I'm going to want to use the syringe. If it's under 15 milliliters, I'm going to move to the spoon. If it's over 15 milliliters, I'm going to want that baby hopefully breastfeeding with the supplemental nursing system. But if a helper is involved, or if the mom or baby are separated, finger feeding works very well as well. So please let me know if you have questions, and thank you for watching.